Multimorbidity refers to the presence of 2 or more long-term health conditions in one individual. This affects 67% of the population over the age of 65 in Scotland, which is a big number and a big deal. Social care refers to the group of services delivered to individuals who may need assistance living independently. This may be things like helping getting washed and dressed, moving about the house safely, or taking medicines correctly. Home care is when someone comes into your house and assists you with these type of activities. The chart shows the proportion of people over the age of 65 receiving home care in all the 32 local authorities in Scotland. The orange dot is 2016, the blue dot is 2007. There's 2 important things to take away from this chart. Number 1, overall, there's a big reduction. In fact, 10,000 fewer people getting home care in 2016. Number 2 is variation. Fewer than 40 people per 1,000 up at the top, more than 80 people per 1,000 down at the bottom. It's a massive variation, and it begs the question why. Part of my research is looking to see whether levels of multimorbidity in local authority areas affects how much social care needs to be delivered. So how are we going to do that? So every time someone uses a public service in Scotland, an administrative data record is created. In the health service, if you want to use it and if you're registered with the GP, when you register with the GP, you're given a unique Community Health Index or CHI number. This number allows us to link together all the different types of administrative health data records. So if you go to the doctor, are admitted to hospital, prescribed a medicine, we can link these records together with the CHI number. What's new and exciting now is that advanced statistical techniques are allowing us to link to administrative data records outside of the health service that may not have a CHI number. In my thesis, we're going to be using the Social Care Survey, which is collected by the Scottish Government every year from the 32 local authorities, and it details the type and amount of social care that they provide. This linked health data set is going to allow us for the first time ever to assess whether the amount of social care someone receives is affected by where they live, their deprivation status and their multimorbidity status, and whether all of these things affect that variation. We'll also be able to assess whether social care affects how much unscheduled healthcare a person uses, and whether those reductions are having an effect on that. So why are we doing all of this? Well, there's been huge changes to the way we're delivering our services in Scotland recently with integration of health and social care. This recognises the fact that we need to find new ways of delivering care, and we're hoping that if we spend more time thinking about primary and social care services, we can reduce unnecessary and expensive unscheduled healthcare. Intuitively, this makes sense. However, there's very little evidence that tells us how our health and social care services interact. My research is going to shine a little bit of light on this, hopefully help us develop better policies, and ultimately deliver better services for our citizens. Thank you very much.